Today, we've got a special guest with us. We have Dr. Igor Burko of SY Aesthetics in New York City. He's doing some really fantastic things through social media promotions and really showing his authentic self to the community. And so we're excited to talk with you today. Why don't you go ahead and introduce yourself and tell us a little bit about SY Aesthetics?
Sounds great. Thanks for having me, Michelle. I really
Of
appreciate
course.
it. And thanks for reaching out initially. But yeah, my name is Dr. Igor Burko. I'm a board certified plastic and reconstructive surgeon. I have training in general surgery as well as plastic surgery. And now my real focus is aesthetic plastic surgery, really of the face, breast, and body. And yeah, we practice in the New York area. So we have two locations, one in Manhattan and one in Middletown, which is in Hudson Valley.
Fantastic. And so you mentioned that you were doing some different things with social media and really feel like you are the face of SY Aesthetics and have seen a lot of videos and posts about you, and is just really wondering if you can talk to us a little bit about how that strategy came about and how that's working out for you, kind of the day in day out, what it takes to really make that come to life.
Yeah, I mean, I think it really just depends what information or what image you're trying to really portray out to the public. And, for me, it's all about just being real and authentic. And so, of course, you need to show results, before and after results, because that's what patients are coming to you for. If they want some sort of change and they just want to make sure that you are able to deliver the results and their aesthetic and your aesthetic align. That's extremely important. On the other side of it, and this is just my personal opinion, I like to show kind of my personality, so when I'm talking, I'm really just trying to be conversational in my videos. As well as my posts. And, it's funny because a lot of patients come in and they'll say, "You're like the same person that I saw on Instagram or Facebook." I'm like, "Yeah, this is me." And so that's really important to me. And I think patients, are really warm to that. And so, yeah, that's kind of my motto. And from a day in, day out standpoint, it's not easy sometimes because you want to be creative and you want to show something that's kind of new. But part of it also for me is also providing just education to the public about the procedures that we do. Not just me, but plastic surgeons in general, just so they're more informed. And these are big decisions. And so you really need to have all your information ready.
As the medical director there, you obviously have your hands in a lot of different things. Can you talk a little bit about even the day in the life of what you're doing in your role and how you are really exploring all facets of the company? Because I imagine that takes time to, put together these videos and to coordinate that with your marketing team and your staff, but so much else that you are doing, obviously, that is taking up a lot of time. So are you still day in, day out, the main plastic surgeon there where you're meeting with patients as well? Or are you more operational? If you could tell us a little bit about more specifics on your role.
Sure. So, yeah, I am the main plastic surgeon, although we have somebody who just started at one of the locations. So that's a big help. As far as, covering all the different roles, I think it really truly starts with a team, so it's not just me, sure, like, I do a lot of the leadership and a lot of the oversight, but I'm really nothing without my team members and my staff. And so I rely on them, they rely on me, and team camaraderie not only builds morale in the office, but we're allowed to cover multiple different tasks efficiently. And they truly help me a lot.
Awesome. And so I'm sure most of the people that I talk to that are in leadership positions, they need to surround themselves with really organized people so that those staff members can kind of keep them in line and keep them in order in terms of
Right.
like what needs to happen, what do we need to prioritize. I remember in a previous conversation we had, you were, when we were talking about social media, you said that that's really been a huge organic channel for you in terms of word of mouth and referrals and sharing testimonies and whatnot. You did mention that you have like a 50-50 split that your team helps with as well on the paid side in terms of some paid marketing. So
Right.
can you talk about that facet and what you and your team are doing on the paid media side?
Yeah, the paid media side is really just usually a couple things. One is, of course, education. So talking about specific procedures, talking about our facilities to really gain the trust of the public and the patients, right? I mean, we have two facilities, but we have three accredited operating rooms across two facilities, and they're Quad A accredited operating rooms, which, again, as the medical director of both offices, it takes a lot of organization to get maintenance and accreditation of ORs. It's not something that's, just handed out to anybody. So really just, first telling the public, you're in good hands. You're in a qualified facility. You have a board certified plastic surgeon. I work with a board certified anesthesiologist, pretty exclusively, one or two anesthesiologists. So they know me, I know them, we know each other's style, and that's really important. Again, back to the team environment. As far as marketing, so that's one side of it. The other side of it, of course, is talking about specific procedures. What am I able to offer? What am I able to deliver as far as results? From the organic side, it's just, again, showing the office, showing the facility, and showing results, as well as myself and my kind of personality or approach to surgery.
So do you have an internal marketing team that helps you balance the organic and the paid channels, or is that something that you've outsourced in the past?
The paid campaign channels is outsourced. Some of the more organic stuff, more of the day-to-day content, whether that be Meta, Instagram, Facebook, etc., that we do in-house. And then, sometimes what we've done in the past is, if we're thinking about, creating some sort of campaign with a specific procedure, for example, we communicate with our outsourced marketing team, and then sometimes we will even contract out a videographer, a photographer for a day. We're making content, then we're kind of, delivering that content to the marketing team.
That campaign driven strategy then kind of helps you build that content for the long haul for a few months, be able to really kind of make that splash in the market for that particular procedure or product.
Right.
You talked too a little bit about how through the education and through patients who have already seen you and had procedures with you, that you really try and become almost a one-stop shop for them in terms of letting them know that there's other procedures and other ways to help them, because they've already built this relationship with you. And I'd love to hear a little bit more about some of the strategies that you employ for that technique in terms of that repeat business, repeat customers and patients. What's been maybe some learning lessons, and what are some successes along the way that you've seen?
Yeah. I mean, I truly, so what we're talking about is patient retention, and that's extremely important in any practice. I mean, really in any business, to be honest with you.
Absolutely.
And the way you retain patients or any other type of customer is, one is trust, right? Patients have to trust you. They have to feel like they're being cared for, not only as patients, but as human beings, as people. Do you care about what's going on in my life that might be affecting my decision right now? It's not just, you want a tummy tuck, we can do a tummy tuck. Sometimes it's got to be, your social life has to be ready for it. And, I'll tell patients sometimes these are huge decisions. You got to plan your life around this: work, family, all these things. And I understand that. So building that human trust with your patients. And then, of course, when you deliver the results and they have a great experience, they're going to come back. And they're going to not only come back, but they're going to refer you other patients, family, friends. And, that's a great feeling, because that really shows you that they're happy. And then, yeah, showing the services that we offer. One thing that we're doing is, and it's kind of always a work in progress. You're always trying to make it better. There's no such thing as like you make a decision and it lasts forever. You can always improve, and that's true for anything in life. But one thing that we're doing is surgical patients, in a way to show our gratitude to them, is after surgery, a couple weeks after surgery, we're having them be introduced to our non-surgical providers. So we have a PA esthetician, to the med spa side of the practice, and giving them really a complimentary treatment. And there's a couple treatments that them and the provider can choose from. So it's not just Botox, for example, although that's one of the options. It's really of, what's bothering you? Is it your skin? Is it some wrinkles? Is it a little area that on your face that maybe a little filler can help? Is it a massage? You just want to feel better. Is it a facial? Just like that glow up maybe before, a big date night. But, they really like that.
It's fantastic. And again, I feel like it's always nice when you're surprised, it's not something that you're telling them in the beginning that, oh, and when your procedure's over, this is something that we're going to offer you. It's the unknown. It's the unexpected that I think really, takes people by surprise and lets them know, wow, they really care. And, they're trying to show me other ways that I can take care of myself. So, especially giving them more of a menu of options to choose from. I think that's a super smart strategy. Probably a lot of people, I would imagine, take you up on that. What's the percentage of people who take you up on that?
Yeah, pretty much 100%. Yeah, pretty much 100%.
That's fantastic. That's fantastic. Okay. Well, and that's the thing too, is that once they get those, a lot of those procedures, am I correct in saying, or maybe a large percentage of them are maintenance type of procedures where once they have something done once, they might want to come back and then get onto a normal cycle where and you are able to package things for them for a longer term period.
Yeah, that's definitely part of it. For an example, injectables, whether it's filler or Botox, for sure. They just don't last forever. Everybody knows that. Those are maintenance treatments. But sometimes something as simple as even like a massage, it's not necessarily a maintenance treatment, but I basically, I don't want patients to feel forced to do something invasive. If you don't want Botox or filler, you don't have to do it. Let's say we did breast implant surgery a couple of weeks ago, you're happy, you're recovering, and all you want is like a hydrofacial massage just to feel good. That's fine. That's not necessarily maintenance treatment. It's really just to introduce you to the other providers, introduce you to the other side of the practice. That's all it is.
Sounds fantastic. I've never had one of those before. So
Me neither, but I hear they're awesome.
there's so many new cool things that
Yeah.
are coming on the scene that I just don't think that people even know. So that education really, really is important. Are there things that you want to tell the audience about that are new and upcoming procedures or services that you're offering that are new and cutting edge?
I mean, we're doing some, like multivitamin IV infusion therapy. We've even considered including that in some of our surgical patients. So a couple weeks before surgery, multivitamin infusion, really just to optimize you. I mean, everybody I feel like is vitamin deficient in general nowadays, right? Because everybody's busy and nobody's getting sunlight. And then even a couple weeks after surgery, it's a multivitamin infusion. Other things, pretty straightforward stuff, whether it be microneedling, just to improve the texture of the skin. Again, back to injectables, red light therapy. That's a big one. That's a really nice one. Patients really like that. And that's, showing improvement just from a surgical standpoint, even healing at the cellular level. A lot of people are doing that across the country now too. Yeah.
It speeds up the process.
Yeah, I mean, it's just like a healing thing. Do I think it makes a massive difference? And this is not really a scientifically backed answer. I really don't think it makes a massive difference. Do I think it does any harm? I really don't think so. And so sometimes even just psychologically, if the patient is feeling good during recovery, that helps. That's really important. And they're just feeling better. If you're mentally feeling better, you're going to recover better. If you're mentally not feeling well, your body's going to respond to that.
It's going to work that much harder to heal you, right?
Right.
So in terms of just looking ahead and some of these new services and procedures that you're offering, what are some, when you're looking ahead, what are some of the big areas that you see for growth for SY Aesthetics?
Yeah, I think one of our visions is the integrative approach. And that's kind of what you hinted at in the beginning, is kind of a one-stop shop. So, there's kind of two sides of the practice, surgical side, non-surgical side. And so the goal is, how do you integrate all of that together? And so it can be non-surgical services in a med spa that we talked about, surgical services, obviously, that we offer, but really creating an integrative side with something like IV infusions at the cellular level, make you feel better, help you get optimized prior to surgery, then do your surgery, then provide some care after your surgery, aside from the surgical care that's standard, to help you recover quicker, better, more efficiently, faster, right? And so even if it means, if one type of surgery you recover for takes 2 to 3 weeks, if you could get that down by even a week, that's a huge difference in somebody's life. They're feeling better a week sooner. And so they're back to their normal activities a week sooner. That's a huge deal, especially for a lot of my patients. And, most of them are moms. So they got to get back to family life and kids and all those things. And I understand it.
You touched on the social aspect as well, too, in terms of just preparing them for what is to come post-surgery or post-procedure. Can you talk a little bit about how you prep the patients for that? Because I think that there's that might not be something that people always think of. They think of the end result, but not the journey to get there, and how they explain to people, or how they transition, or those conversations that are included in be in consultation?
Yeah, for sure. The social aspect of the consultation is a big part of the consult for me. It could be, I ask questions, what do you do for work? What kind of work are you doing? And not necessarily what you do for monetary, but what are you doing physically at work? Is it a desk job? Are you lifting? Are
Mm-hmm.
you expected to strain depending on the type of surgery? Who do you have at home that's relying on you? Who are you able to rely on for this recovery? Do you have help? How are you going to get here? Where do you live? I mean, these are huge questions. It's very easy to just do the surgery and say, great, looks great, but you have to get, I believe, we always have to go back to the fundamental principle of medicine and not just surgery, but you have to care about the person and the patient, and everything else will follow, and it will follow in positive ways.
Sounds like you're not just preparing them for the procedure, but you're preparing them for life, really, and how their life might change or what they need to prepare for, because there is probably a lot of unexpected that comes up. Not necessarily being able to anticipate everything, but really trying to check as many boxes as you can prior to surgery time.
Yeah, I basically call it like logistics post-operatively, like
Mm,
post-operative logistics, right? And like there's kids relying on you at home that, you're going to make dinner, but if you just had a tummy tuck, I don't really want you cooking for about a week or two.
right, right.
So
I'm
these
I'm
are,
sure any of the females or moms that you work with are probably like, "Oh, we extend that a little longer, doctor."
that's funny you say that. So I sometimes tell my patients, I'm like, all right, these are the 2 weeks that you get unlimited free massages from your spouse. Use them and abuse them.
Yes, yes. Fantastic. Well, kind of transitioning back, I just thought of something, from the digital conversation that we were having earlier, and kind of just this balance between paid and organic. I'm just wondering the future and everything that's changing with technology and AI coming up aboard. What are some ways that you see the landscape changing for your office in terms of marketing? And technology wise, are there also tools that you are considering or have begun working with? It's kind of a two-part question. So marketing
Yeah,
in the future of marketing, but then
yeah.
also, from a tool perspective, where are you heading and what are you considering to help facilitate that?
Yeah, that's a good question. Obviously with AI, it's like on the landscape at like exponential speeds and improving and just getting more diverse and more capable. But I think if you can use AI and technology to really be more efficient, I guess in my opinion, then it's of course worthwhile. But you really have to be careful because I think you can get very non-authentic. I
Mm,
mean, for example, I mean, you can post a video today in a different language. I could be speaking English. I could do this whole educational video about some sort of procedure. And I'll just say, can you just put it in that language? And it's like me lip talking, but it just comes off fake.
mhm.
It's fake, right? Like I always say this, like you give me a teleprompter to enunciate another language, I will struggle through it, but at least it will be real. I may not
Yeah,
want to post that because it sounds ridiculous, but I'm not going to, I guess, abuse AI and technology because it's not authentic. And at the end of the
right.
day, this is still medicine. This is surgery. This is real life. It's not like Instagram.
So how do you see, I totally agree, by the way, because I do think that there's over usage sometimes, of
Right.
these new tools, and really taking a step back to say, okay, how do we want to use it as part of the system, but
Right.
not as lead?
Right.
You as the doctors and the staff still need to be the lead that are having these conversations, that are the human touch, that are making those personal connections. I'm curious to see if there's bottlenecks. You said from an efficiency standpoint. Are there bottlenecks in operations or the processes that you guys follow where you think that technology or AI tools would be able to help?
Yeah, I think one area that, a lot of practices are, using AI and considering integrating AI is, virtual assistants, really for even sometimes what I think is not a bad idea is off hours, meaning a lead is coming in from somewhere, a different time zone, interested in your practice, but it's 3 in the morning here, right? Obviously the office is closed. I can't expect staff, to answer
Right.
all the leads. And so maybe having like a virtual assistant, and some of them, we don't have one, but some of them, at least from what I've heard from other practices and some companies, I mean, they're pretty efficient. I mean, they respond, they're live, they accurate information, they'll send you links, they'll set up an appointment. And so I think that's extremely beneficial, because the other reality is if somebody's in a different time zone, they don't really care that you're in the different time zone. So if a
Right.
lead comes in at 3 a.m., but it's 3 p.m. there, they want an answer. And
Such a
so,
good point.
right. And so if they inquire to, let's say, SY Aesthetics, they don't get a response. And then they inquire, they say, you know what, I didn't get a response. I'll go to the next practice. Maybe the next practice responds. And so it's really, and I don't blame them, the person who responds first is probably going to get a dialogue.
Yes, so I do see a lot of value with that as well because you hit it on the head. Our time zone is our time zone, but there's 24 different time zones that people are living in, and
Right.
if they've done the work to come to you
Yep.
in those off hours, think about just with search engine optimization and
Yep.
what it took for your content to actually get them to connect with you.
Yep.
That's gold. That's
Yes.
absolute pure gold, and being able to connect with them pretty quickly. Speed to lead, as they say,
Yeah.
is really important to make that connection as soon as possible. So I think that's a really good point. Okay, so if people wanted to follow you and if people wanted to learn more about SY Aesthetics, what would they need to do? You wanna provide some information for our listeners?
As far as like how to find us in a way, or
Yeah,
yeah, I mean,
yeah.
so we have an Instagram, an SY Aesthetics official Instagram, which is for the practice for both locations. I have my own personal Instagram, Dr. Burko, and so that'll show everything before and afters, educational content, so personal life. I have a beautiful wife, and I have like I told you, I have a son, and I'm about to have another kid, and so sometimes I'll post that because
Congrats.
thanks a lot. Because also patients want to like they see you as the doctor, as the surgeon, but at the end of the day, like we're human beings. We have families, and that's also what allows us to connect with them. Like I understand you have kids at home, like I have kids at home too, and so I'm definitely able to relate. Otherwise, SY Aesthetics, we have a website, of course, that we're actually like any day now gonna completely change. We're modernizing the website, so look out for that. That should be really nice. So I've been working with a web developer
Very
on that.
cool.
Yeah, just because it's just going to be better looking and just better and more optimized. So that's really important. But yeah, that's pretty much it. And of course, our two locations, one in Manhattan and one in Middletown, New York.
Wonderful. Yeah, just would think with the type of clients that you're serving, premium offerings that you have in your menu, really need to make that first impression strong when individuals come to you. They may come to you through a paid advertisement or organic post or something along those lines, but when they hit your website, you want to make sure that it is
Right,
on par and premium. So
right.
I think that is one thing that sometimes private practices kind of forget about. They like set it and forget it, and then it's like,
Right.
okay, the website's up, we're good to go there, and that sometimes gets forgotten. So kudos to staying pretty progressive and
Yes.
current with that.
Yes.
Look forward to it. So one last question that I like to ask all my guests
Yeah.
is, if you could look back on your journey of being a doctor and coming to SY Aesthetics, running a private practice, what is something that you wish you knew not, or wish you knew then, but now about running an integrated private practice that you can impart on our listeners? So what's some good advice?
Yeah, that's a good question. I think one area really is the marketing side and how important it truly is. You know, I think we're not trained to be, influencers. We're not trained to be on camera, right? We're trained to do surgery, take care of patients, and, medicine. And so marketing is huge. And so just learning, what content to make, how often to make it, because you don't want to make it can't be every day either, but it can't
Right.
be spaced too far apart. It can't be just before and afters, but it also can't just be educational. It's got to be like fresh and like the perfect ratio and duration in between those posts.
Hmm.
And to be honest, it's still like I'm learning every day. It's not like, and I don't think it's something I'm ever going to be like, okay, I figured it out. I'm the master marketer.
And it changes every day too. Just
Yeah,
when you think you're catching on, and it's like, oh wait,
right.
now there's this thing to go after. So I think that's great advice. Really kind of making yourself probably more comfortable and maybe coming out of your comfort zone a little bit, I
Right.
think, because to really truly be able to show your authenticity, you have to show your true self, and you kind of have to leave that ego at the door and really be
Right.
able to just let people in. I think you've done a really, really great job with that.
Thank
So
you. Yeah.
yes, yes. Thank you so much for coming on the show
Yes.
today. Really appreciate all your feedback and insights. I know the guests are going to learn so much from you. And I just want to go ahead and thank you for joining. And this has been a Growth Cultivated podcast, a Blue Bonsai podcast. If you found this conversation helpful, please be sure to subscribe and share with others in the industry. Until next time, keep cultivating smarter growth.
Thank you so much for having me. I appreciate it. Thank you.
Take care.